I'm Bruce Marshall. This is the Brampton Now Update for the May 7th, 8th weekend 2021. Happy Mother's Day. Coming up, cautious optimism from the chief medic, though Brampton Civic remains at capacity with hospitals all over Ontario helping out and Canadian Forces medics now on duty at Brampton Civic Hospital. Getting the vaccination is the thing to do on everyone's to-do list, ages 18 and up now. Some sun, maybe some rain, temps in the teens for the Mother's Day weekend, according to Environment Canada. The full current forecast for Brampton is at the link in description. This is the Brampton Now Update. Here's what's happening in Brampton. Optimism from Peel's chief medic.
There are early indications that our curve is starting to bend, but I must reinforce that this trend is early. We have been here before in the other two waves, and we know that we cannot let up. Success depends on continuing to limit our contact and interactions while getting vaccinated more and more.
And from the mayor.
Our hospital system continues to be at capacity.
But the backstory to Brampton Civic being at capacity here in Brampton, where we have less than half the hospital capacity of the rest of Ontario on average. Another story is the number of Bramptonians who are being shipped out of town.
So just to give you a list, in the last week, there has been 139 patients transferred to other hospitals. Think about that, 139 patients. More than our hospital could handle in totality have been transferred out in order to support the capacity at Brampton Civic.
The chief medic also had a report on his Section 22 orders. You remember, those are orders that close a business either partially or fully where the virus has spread.
We're also in week 2 of our updated Section 22 order for workplaces and have started to see our workplace closures get ahead of outbreaks of the variants in our community. I do want to thank all of the impacted businesses that have complied with our investigations and have done their part to keep their employees and our community safe. Your sacrifices are helping, and while we are far from the end, we've also never been so close as we continue to vaccinate steadily.
And vaccines. Peel Health has become a vaccine-giving machine.
Our vaccine campaign continues to administer over 100,000 vaccinations a week across all channels. Every single dose we deliver is going to a resident of a hotspot. We welcomed the province's recent announcement and move to bring 18+ in hotspots to booking, as it allows many more of our residents to access our system and get vaccinated, and bring us closer to the 75% first dose target in our community.
So what do you need to do to book your vaccine appointment if you haven't had yours yet?
If you live in a hotspot in Peel, which includes all of the city of Brampton, now is your time. Please visit peelregion.ca/COVID-19 vaccine to book your vaccination today. If you couldn't get in earlier this week, I urge you to try again. The website is now faster and more appointments are being made available every single day.
In a moment, another scandal seems to be gripping City Hall in Brampton. This story swirls once again around the chief bureaucrat in Brampton. More next on the Brampton Now Update.
Is going to a party really worth it? Putting yourself at risk puts everyone at risk. Help limit the spread of COVID-19.
I've been to hundreds of car accidents within the region of Peel, leaving the scene knowing every one of them could have been avoidable. Please, take the pledge.
This is the Brampton Now Update. I'm Bruce Marshall. Scandal in Brampton on a micro and macro scale. Currently, questions swirl around the city's chief administrative officer, 𝗕𝗿𝗺𝗺𝗺, and alleged improprieties in his work. Fundamentally, it looks like Berwick was doing everything he could to consolidate many functions in his office. Financial issues and the oversight of money is one concern. Another is the consolidation of information in the CAO's office. Berwick apparently came with little experience running any large organization. Bit of background on the chief administrative officer in a municipality. They're like the CEO of a corporation. That person is the top civil service job in the city. Higher up on the food chain from the CAO is the city council. So it's a big job that impacts many of municipal services we rely on. There's a lot of detail to this story. It's the kind of story that is best served by print. And journalist 𝗕𝗿𝗺 of The Pointer digs into the details on this in several pieces. Likewise, stuff from the Brampton Guardian by City Hall reporter Graham Frisk and others in the Metroland chain cover other angles of this many-faceted story, which started with a scandal in the Niagara region. This against a backdrop of the province is looking for input on regulations to hold municipal politicians to greater account. Many calling this a reaction to the matter in Brampton, where a councillor is alleged to have committed a sexual assault while on a foreign business finding trip. The twist in the Brampton case was that the alleged offense occurred in Turkey, where police were not interested in investigating an allegation by a woman that she'd been assaulted by a man. Thus, with Canadian law not having any force here, the Ontario regulations will seek to hopefully have a mechanism to hold councillors to greater account in such cases. As it is now, the most any city integrity process can do is basically a slap on the wrist. The Brampton case demands tougher accountability. The Ontario government survey is at the link in comments. In a moment, Brampton Civic is a very busy place. Mayor Brown with a long list of thanks to people and institutions next on the Brampton Now Update.
Canadians are dying of overdoses every day. Stigma is making it harder for people to get help. Addiction is a treatable medical condition, not a choice. Help end the stigma. A message from the Government of Canada.
There are some things you just don't do halfway. Fighting COVID-19 is one of them. As vaccines roll out, let's keep giving this our all and continue to follow public health measures. A message from the Government of Canada.
I'm Bruce Marshall. This is the Brampton Now Update. We don't realize how many organizations are working in and around Brampton Civic until the mayor gives his thanks.
So I want to thank the Halton Healthcare Network, Mackenzie Vaughan, Mount Sinai, UHN, Unity Health, Sunnybrook, Royal Victoria Hospital, and a number of others. But those are the hospitals that have stepped up, that have allowed us to handle the healthcare volume that is coming out of hotspots like Brampton.
And of course, thanks also go to
the healthcare heroes that came in from Newfoundland and Labrador. They arrived this week. They have now joined the team at Osler on the front lines. And I know human resources was becoming a challenge. You know, we have exhausted frontline healthcare workers, and this help from Newfoundland is much appreciated. And it goes to show that this is a Team Canada approach, and we need to help each other out.
That's the Brampton Now Update for this week. Please hit subscribe on the Brampton Now Update channel on YouTube at the link in comments, or follow #MarshallMinute. The Brampton Now Update, your weekly reliable source for all things Brampton, unbought and unbiased. Your comments and suggestions are always welcome, and if you've got a Brampton story to tell, get in touch with me through the channel you're watching on right now. Happy Mother's Day. Stay strong, Brampton. Brampton strong. We're all in this together. I'm Bruce Marshall. Thanks for watching Brampton Now Update.
Quiet, numbskulls, I'm broadcasting.